Hello, and thank you for tuning in to Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people who are making it happen behind the scenes. I'm Dr. Bobbi Pritt, Interim Chair of the Department of Laboratory Medicine and Pathology at Mayo Clinic in Rochester, Minnesota. With me today is Dr. Bill Morice, the President and CEO of Mayo Clinic Laboratories. This is our weekly discussion with Dr. Morice, in which we learn about updates in the field of laboratory medicine and pathology.
Hi, Bill. Welcome back.
Gosh, it feels like it's been a while. It's always great to see you. So
Yeah, happy spring.
yeah, spring indeed. Spring cleaning at my house. A lot of activity right now too. A lot of conferences are kicking up. And interestingly, now that I've been in this role for a few years, as the MCS Mayo Collaborative Services President and CEO, I'm getting invited to more kind of different meetings to offer some different perspectives. So next week I'll be actually going to Becker's Healthcare Conference and giving a keynote on Monday, and then I'll get on a plane and travel to New Orleans Tuesday. Monday night. For Tuesday, I'm hosting two panels at the Executive War College, which is another meeting that started by Robert Michel. He's actually transitioning now. He's out of that role. He's done it for many, many years. It's a great meeting. It kind of covers the sort of the business of hospital laboratory and what's happening in that environment. So doing that, and then seeing what that's going to be like with new leadership. It may become even more. It's been growing a lot, but I bet it'll become even more vibrant than it has been. But not that Robert's done a great job. And then last but not least, I'll come back, and then on May 8th, I'll be recording a webinar on the value of the lab with Becker's. And so, or not recording, it'll be a live webinar on May 8th. So already a lot of people signing up for that, because it's maybe we can talk about it sometime, but it's interesting message and important message right now for all of us in the laboratory, I think. So it really produces our experiences as collectively about how valuable. I mean, you know this so well from your time as serving as department chair and just being a consultant here like myself. The ability to have Mayo Clinic Labs is sort of like the Uber outreach to bring in specimens and what that's really done for the patients that we serve and our own practice. So it'll be fun to talk about.
Yeah, the laboratory is so valuable to the healthcare system. Well, we will definitely be talking about those in a future podcast. I hope with all that travel, you still get some time to yourself.
Well, kind of semi to myself. Like Gretzky and Hattie, of course, have spring fever as well. So they have to get out and go for walks, and we have to be. Unfortunately, we haven't been to our cabin yet, but we'll have to really watch out up there because we know it's time for the arthropods.
Oh, yeah, so true. Well, that's what I wanted to talk about for the bulk of this time, is tick-borne diseases, because it is that time. And you've heard me say many times, as soon as the ground starts to thaw, the ticks are out, plus the mosquitoes are out. Thankfully, they're more of a nuisance right now, but they'll be, spreading West Nile virus and other things later on in the year. But yeah, the ticks are going to be out and they are biting. And many of them already have human pathogens that they can transmit with their bite.
Yeah, wow. I mean, that's something I've certainly learned through you and from you, is just how important it is to be aware of tick-borne illnesses. They're not as uncommon as people might think, and really the importance of of the lab and diagnosing tick-borne infections, but also the importance of just trying to prevent tick bites, because of some of the disorders are not even infections. If you think of some of the things you can get from a tick bite, are not very easily treated. So we probably should go through that as a reminder for people too, so they're thinking about it.
Yeah, so prevention is key. I always say, well, first of all, know what's prevalent in your area. Tick-borne diseases are variable depending on where you are in the United States and parts of North America, Canada. Lyme disease is the number one, but you don't find Lyme disease being highly prevalent in all areas. But then you have other things, like you said, the Lone Star ticks can set you up for alpha-gal syndrome, so-called meat allergy. Very difficult to treat. Like you said, you basically have to just avoid meat for months, which is really hard for some people. And then there's other diseases that could be even life-threatening, like babesiosis in a patient without a spleen. That could be very dangerous.
Yeah, it's wow. And the challenge, of course, well, when you don't think about your knowing your geography, knowing the area that you live, and of course, the disease that most of us think of as being a tick-borne disease. Lyme disease is actually named after the location of Lyme,
Mm-hmm.
Connecticut, where it was first identified, and we are in. So knowing what's endemic in your area. But the other thing, and I'm sure well, I'm not sure. I'll look to you to help me with this, but it's been noted that the distribution of ticks is spreading as we've seen climate change. And so like Lone Star ticks, I think, are moving further north and some
Mm-hmm.
things like that, right?
They are. And then the Ixodes scapularis, the so-called deer tick or black-legged tick, they are expanding into new areas. So it's about half of all the counties in the United States have Ixodes scapularis now, and their ranges are expanding. And it's complicated. Climate change definitely plays a role, but as does land use and how we are expanding into areas that were previously forested. And now we have these broken habitats, lots of deer. Deer help with the spread regardless of what's causing it, we have ticks in places where they just weren't in the recent history. And so people need to know that they're out there. And then it gets back to preventing
Yeah.
those tick bites.
Well, I know you have your ABCs, I think. So
I do.
what are some of the key prevention before we get into how the role of the lab in supporting, the diagnosis of tick-borne diseases? Just what are some of the keys to prevention?
Yeah, let's do the ABCs. I actually did the A through Zs. We have these flashcards. We'll include the link in the podcast information, but I managed to come up with a word that talks about tick-borne disease from A all the way through Z. But let's talk about the ABCs of tick bite prevention. So A is avoid the area where they are found. If you are walking in a path, avoid the areas of tall grasses. Don't go out in areas where you know there's going to be ticks if you don't have your tick protection on. So that brings me to B, which is bug spray. You want a tick repellent or something like permethrin that will kill ticks. You can spray that right on your clothing. And then C is clothing. You can also just prevent tick bites by covering up. Make sure that you just don't have a lot of skin that's available for those nasty little arthropods that want to feed on your blood.
Yeah, yeah, that's easy to remember, and that's what they are. And it's like
Hmm.
it's funny. And you have to really be mindful of it. I last fall, I think it was, honestly, I was in northern Minnesota again. Liz and I, my wife and I, were out on a hike with the dogs, and we ran into an area of tall grass, and we decided, oh, we'll just power through it.
Yeah.
And man, they were, we didn't think of it. They were loaded, and even though we were covered, we were getting the ticks from our animals, and that's
Yep.
another source to really think about. Even if you've treated them with, one of the oral anti-tick, medications, a lot of times they have to bite to actually even. So it's something to really be kind of vigilant about if you're in an area that has ticks. It doesn't take very much. You've talked about how they just hang at the edge of those little
Yep.
pieces of
Yeah.
grass, and even little pine trees that are on the ground and stuff like that. So
Yeah, those black-legged ticks, they do a behavior called questing, as does the dog ticks, where they basically just crawl up on the tallest surface, which could be a bit of a leaf, could be some branches, and then they just extend their legs and wait for something coming by on 2 or 4 legs, and then they just grab on. So yes, you should be doing tick checks frequently, and that should be for your whole family, and that it also includes your pets, because your pets can bring the ticks inside the house. And your pets may be protected, as you said, but that they actually have to bite uh, to be exposed with your pets, but they could get carried in on the fur of your animals, and then they could bite you instead, and you probably don't have that same protection
no, I have not used any of those Provecto or any of those.
on
So
yourself.
yeah, myself. So yeah, and that we have had that. I mean, we've noticed
Yeah.
that, and it's always then you get the heebie-jeebies, and everyone has to check and
Oh,
hope
yeah,
it.
they're crawling in the house somewhere. You don't know
Yeah.
where. Yeah, so just do those tick checks. If you're in a really highly endemic area and you are just out hiking in tall grasses, you might just want to take all your clothes off before you go in the house. But watch your neighbors; they may not
Yes.
appreciate that.
Or they might. You never know. Either way, you should watch. But it's like questing. I certainly don't want ticks questing in my house. That's for
No,
sure.
no, crawling up on
But
the silverware. I can't even imagine it.
yeah. Now the other thing, of course, is the role of the lab, right? I mean, you
Yeah.
and Dr. Thiel and people in our clinical microbiology department here, you have, one of the top-notch sort of arthropod infection lab in the country, I think. Not one of the best in the world, but I mean, there's a real important role for the lab and the laboratory medicine professional, in helping a clinician think about even testing for these diseases, because a lot of times things like Babesia, myself as a hematopathologist, we study these, malaria going back to mosquitoes, and they many times have very protean, meaning non-specific manifestations, and someone might not have to think about it clinically, and the patient might not even recall it having the tick bite. So
Absolutely. 50% of cases of Lyme disease do not remember having a tick bite.
mm,
So we work closely with our patient-facing colleagues, and we've created algorithms for testing based on where you live in the country so that you know what types of infections you might be at risk for. And then based on that, we've created a series of tests. We have some small panels, but it shouldn't just be a shotgun approach where you order all the tests. It can really be done in a thoughtful, scientifically based manner. And the lab plays a huge role because all of these organisms, they're not all treated by doxycycline. You shouldn't just give doxycycline to every patient that comes in with a rash or a fever in the summertime. Something like babesiosis wouldn't have a treatment impact from doxycycline. So
yeah.
the laboratories really plays a key role in making that diagnosis.
Yeah, no, I mean, absolutely. And the way that you've constructed the test menu and the ordables to kind of reflect that is really impressive. And I mean, it's something anyone should be thinking about. And the other thing is, especially here in the summer, is to also make sure that the patient-facing care provider, whether it's a nurse or physician or who it might be, also thinks to ask for a travel history, right? Because a lot of people are
Yes.
driving to camp and do other things, and so you might not think of it being in your area. Knowing also what their habits are. I remember, we had my former residency mate, Dr. Juchai, who shared with us his story of his alpha gal syndrome. He's an
Hmm.
avid hunter, right? And so he did all the ABCs, but he still, unfortunately, got exposed to a Lone Star tick. And he, as a physician, did not recognize what was going on with him until he had an anaphylactic episode, which of course can be life-threatening. So again, really kind of educating the role of the pathologist and the laboratory medicine professional to really educate. The old adage of a pathologist is a doctor's doctor, but to really think about educating your patient facing providers, particularly those in like an ER urgent care setting or primary care setting, because again, a lot of times the patients they're not going to say, "Oh, I think I have a tick-borne infection. I need to go see an
Yep.
infectious disease specialist." So
Right.
that's important.
Yeah, they're going to be in the emergency department, in their primary care physician's office, the nurse practitioner, the person at the urgent care clinic. So, right, we need to, as pathologists, laboratory scientists, work with our patient-facing colleagues, raise awareness, help them know which tests to order. There are a good number of tests on the menu, but most of them wouldn't be appropriate in different situations. You really need to know what's appropriate for your setting. And Bill, you mentioned, yeah, a pathologist is the doctor's doctor. We're also the patient's doctor. And so I
Yep.
think that's why you and I feel so passionate about doing this podcast and getting information out to the general public.
Yes,
We're,
right.
we're
Yep.
everyone's doctor.
We are everyone's doctor. It's I realized that when I had to take my first board exam, and you had to cover basically everything from
Yeah.
newborn diseases to autopsy. So yes, we run the gamut. But
Yeah.
that's what makes our profession so enriching and so enjoyable, and everything else too, and important for healthcare. So yeah. I
Yeah.
guess the last question really is like, where would if someone wanted more information, what's the most credible place for them to go?
That's a great question. I have two primary resources. One is the CDC, and they have great information with epidemiologic data of what is happening in different parts of the country. But then our Mayo Clinic Laboratories website has a lot of great information as well, all based on data and statistics from our public health laboratories. And we'll be hearing more about that as the season unfolds. There's great information on our website. And so I refer people there. That's where you can find the A through Z flashcards as well.
All right. All right. I'm heading there next.
Yeah, they're great. Well, Phil, it's always a pleasure speaking with you. And next time we talk, you'll have to tell us about some of the conferences you've been to and the talks you've been giving.
Yeah, that'd be great. Be fun. I look forward to it.
All right. Stay safe out there.
Okay, you too.
Okay. Bye. Thank you for tuning in to Answers from the Lab. Be sure to subscribe to this podcast and tune in every other Thursday for new episodes.